Good afternoon, everyone. It's 2 p.m., so it's time to start the very first H.A.R.M.O.N.Y workshop. Let me please welcome you here. My name is Lucie Havlíková, and I'm here on behalf of the National Institute of Mental Health in Czechia, and I'll be the moderator for today. We're delighted to have you here for this online session focused on mental health and well-being in the workplace, an area that's gaining a serious attention across Europe and beyond. This workshop is part of the H.A.R.M.O.N.Y project, which brings together institutions from several European countries to develop innovative digital tools that help both employers and employees create healthier and more supportive workplaces. We spend nearly 1/3 of our lives at work, some of us even more. And this means that our working environment profoundly shapes our well-being. We also know that workplace initiatives promoting mental health can make a measurable difference, reducing absenteeism, improving job satisfaction, and strengthening employee engagement. Before we begin, before I give floor to our speakers, a few practical notes from my side. Please, you're very much welcome to share your questions or comments in the chat at any time during this session. And after each presentation, we'll take 1 or 2 questions from the chat and we're going to answer them. At the end of all presentations, we'll open the floor for a broader discussion with our panelists, and you're welcome to join with your microphone and camera on at that stage of the presentation. Let's begin with our first speaker, Linda Matisāne. Let me briefly introduce her. Linda Matisāne is a leading researcher at Riga Stradiņš University, and she is based at the Institute of Occupational Safety and Environmental Health. Her work spans psychosocial risk, work-life balance, and evidence-based occupational safety and health interventions for employers and workers. She has authored studies on telework and the impacts of COVID-19 and co-authored recent prevention research focused on transforming evidence into practical tools for SMEs. Today, Linda will introduce the H.A.R.M.O.N.Y project and provide an overview of its structure, goals, and key components. Linda, the floor is yours.
Thank you, Lucie. On behalf of Riga Stradiņš University, who is a leading partner of the H.A.R.M.O.N.Y project, I'm going to explain some key aspects and key components of the presentation of the project. So the H.A.R.M.O.N.Y project is an abbreviation. The word H.A.R.M.O.N.Y is abbreviation of the project title, which stands for Healthy and Resilient Mindset with Organized and Nurturing Digital Tools for Your Mental Health. And mental health is one of the very hot topics currently in work environment where we are switching from the traditional workplace hazards related more to safety and occupational diseases, more to diverse aspects of mental health. And for this project, we have set an objective to join forces to provide support for European companies, especially for small and medium-sized companies, so that the workers can prevent any consequences related to poor mental health at work. And what's very important, we are not just working independently as universities or educational establishments, but we are joining forces from diverse players, including higher educational institutions, including vocational educational training and research institutions, as well as companies who are our project partners and who will also be the stakeholders and members of the knowledge committee. One of our partners is also EU-wide network, European network for occupational health and safety professionals. So you can see that we are really trying to join the forces to cover diverse aspects of the project. So in very brief, I would like to highlight 4 strategic tasks of the project. And the first and the most important task is to improve the SME employers' competence so that they can support their employers, they can help to prevent any mental health issues. And why we want to try to focus on SME employers, on SME, because usually bigger companies are better not only in occupational health and safety, but also in support for mental health. And usually these bigger companies don't lack finances, they don't lack any knowledge. So we want really to support SMEs which employ the biggest part of the workers in EU. However, we really want to have people, workers joining the labor market already prepared to deal with mental health issues. So one of the tasks we will discuss or we will cover will be developing capacity, improving the capacity of teachers, and both in higher educational establishments as well as in professional or vocational schools, so that the training agendas are improved and the training is delivered better for the future workers. Another thing is, we don't want to say that everything is poor or bad. So we already know that there exist quite a lot of good practice examples. So we want to select the best and exchange with them among researchers about occupational health and safety, experts who in part deal with these topics. Also, occupational health and safety service providers and other labor market actors like employers, worker representatives, HR, and other stakeholders. But going in line with the development of digital tools, one of the key parts of the project is investigation how AI and other digital tools can support employers and workers in this road for better mental health, so that the workers can better monitor their own mental health status, so that the preventative measures can be made at early stages. So when we will be finished with the project, we hope that there will be delivered 8 training modules. However, they will not be focused on management of psychosocial hazards at work, because the focus of our project is work-related stress, anxiety, and depression. So these will be the main topics covered within these training modules. And the other big issue will be the AI models architecture, which will be made to better support employees to prevent to overcome their mental health challenges. And all these main outputs will be combined in a specifically designated digital platform, where everyone who is interested in these topics will be able to access free of charge training modules and have a look at the architecture of this AI model. So in very brief, like usually such projects, they are delivered in or divided into work packages. The first package and the last package are not very important for you because they are either administrative or related to communication. But all the other packages where we would like to focus today and also maybe have a feedback from your side is working package 2, which is about knowledge structure, meaning that we will base our outputs on research done already at this moment. So one of the presenters today will present exactly what we have found out through our surveys and interviews. And working package 3 is also one of the topics which where we will discuss today. It's about the AI and technologies what are already used in different countries. So there will be another presentation of this aspect. And at later stages of the project, because the project is three-year project, there will be an employers program. So we will deliver these training modules, and we will prepare this resource platform technically and include all the deliverables or all the outputs in this platform. And to finish my part of the presentation, I would like to highlight that there are 9 partners within the consortium coming from different countries. So we have also done research in all those countries, which are where we have our members. So we have Riga Strategic University, we are the leading partner, but we have H.A.R.M.O.N.Y, a company from Finland, company Prios from Norway. European Network of Safety and Health Professional Organizations is an EU or non-governmental organization based in Germany. Then we have a school from Spain and Vocational Training Institute from Greece. Then we have another company from Norway and 2 institutes or universities, one from Czech Republic, which is focusing for mental health, on mental health issues, and from Croatia, which is more in the topics related to digitalization and AI. So thank you, and I'm giving back the screen to or the microphone to Lucie.
Thank you, Linda. Thank you for the introduction of the project and for highlighting what are the expected outputs of the project, as well as the partners of the project. We don't have any question in the chat yet, so I dare to ask the first question on my own, if you don't mind. You mentioned that one of the expected outputs is the digital platform, which is going to be free of charge, and where all the other outputs are going to be like collected. Would you mind introducing it a bit more, like which functionalities will it have, like how it's going to be used, or if it's already clear?
One of the tasks at this moment is to draft and prepare all the information needed to create or establish such a platform, so that it's easy to understand, easy to find, because it's coming with quite a lot of challenges, like training materials, which will be in different languages. So I would suggest to wait a bit and come back and visit our website so that you are the first to be aware of the platform when it's available and when it's published for and available for end users.
Okay, great. Thank you for the answer, and thank you also for the invitation to the project website. Okay, I believe that it's time to turn to the project's current findings, because we have already like 10 months of the project since it has been started. And within these 10 months, there was a research conducted with small and medium enterprises, higher education institutions, and vocational education and training providers. And this research explored workplace and educational well-being, identifying both examples of good practices and key gaps that need to be addressed to strengthen mental health support across these settings. And I'm happy to welcome our next speaker, Lucie Steinerova. She's a public mental health researcher at the National Institute of Mental Health in Czechia. She holds psychology degrees from the University of Edinburgh and New York University, and her work focuses on prevention and early intervention in general population with a focus on the workplace setting. And within H.A.R.M.O.N.Y, Lucie leads the mental health data collection and analysis to inform the development of the project's tools and digital platform we have just mentioned. So, Lucie, floor is yours.
Thank you for the introduction, and thank you, Linda, for a great introduction to the H.A.R.M.O.N.Y project. As was foreshadowed, I will now present the findings we have gathered through our research over the last few months, and that will be used to inform the subsequent project work packages and tasks. First, we'll cover why mental health education matters, and then I'll show how we used a mixed methods research design in order to understand the issues, talk about the key insights from our research, and finally discuss what these findings mean for schools, businesses, and policy. So before diving into the findings, it's worth pausing to ask, why does this research matter? Mental health issues already cost the EU and UK over 4% of the GDP, which is more than 600 billion euros every year through both direct and indirect costs related to absenteeism and lower productivity. Across Europe, stress, depression, and anxiety are now the second most common work-related health problem affecting millions of employees. And what makes this especially important is that SMEs make up the vast majority of European businesses, yet most of them still lack formal mental health strategies or training. At the same time, mental health teaching in schools often doesn't align with the realities of working life, meaning can you hear me?
Yeah, it's frozen for a minute, but we can hear you now.
Okay.
Maybe turn your camera off.
Yes, probably. Can you still hear me?
Yes, we can.
Okay, great. I'm going to continue because my computer is frozen. So mental health teaching, as I was saying, doesn't align with the realities of working life, meaning the support students receive during the training often doesn't always prepare them for the pressures they'll face on the job. So that's the gap H.A.R.M.O.N.Y is set out to explore, finding out what is being done in order to connect what's taught in education with what's needed in workplaces so that mental well-being is supported from learning to employment. So we conducted both qualitative and quantitative research across 8 partner countries, which are shown on the map to the right. On the qualitative side, we interviewed 77 educators experienced in delivering mental health education, roughly half from universities and half from vocational schools. And our goal was to understand how mental health is being taught and supported, and to identify the strengths, gaps, challenges, and any future directions within these institutions. Our interviewees represented a diverse mix of roles ranging from student counselors, career advisors, psychology lecturers, and practicing psychologists, which gave us a rich perspective on both teaching and support systems. In parallel, we ran an online survey that reached 198 respondents, identified as key employees in small and medium-sized enterprises, including business owners, managers, occupational health and safety experts, HR professionals, and CEOs. Most of the responses came from micro and small firms, reflecting the sort of true landscape of European SMEs. And the main sectors represented were manufacturing, technology, education, and healthcare. Would anybody like to take a guess, either through chat or raising your hand and speaking up? Which of these do you think was the #1 reported issue across our SMEs? Okay, let's show the data then. So when we look at the main mental health challenges reported by SMEs, stress and burnout clearly dominate. Over 60% of the SMEs in our sample identified it as an issue. And in some countries, the numbers are even higher, going up to 70% in Spain, 75% in Czechia and Finland, and nearly 80% in Latvia. Following that, we have poor work-life balance reported by over 40% of SMEs, along with workplace conflicts as another common challenge. What we also found is that training is an area where demand far exceeds current practice. Less than 1/3 of SMEs provide any mental health training, whether for managers or employees. Even more striking, over 1/3 of the SMEs we sampled offer no mental health initiatives at all. And for those that do, it's usually one-off events like awareness campaigns or employee surveys. When we asked leaders what they most desired, 2 things stood out. First, they want tools to recognize and respond early, for example, through stress recognition and crisis support. And second, they want their employees to be able to manage their stress and maintain balance themselves. Across workplaces, 3 needs emerged very clearly: better mental health literacy, empathetic leadership, and an open
I'm afraid we lost Lucie. I believe it was a bad connection. Or is she in? Okay, so let's try to move to the next presentation, and then we'll get back to hers, if you don't mind. So the last presentation highlights one of the most innovative aspects of the H.A.R.M.O.N.Y project, the use of artificial intelligence to support well-being at work. And our next speaker is Professor Mršić from Algebra University. He's a professor who is also a vice rector for science and research and Algebra University in Zagreb. He holds degrees in business economics and statistics with PhD in information science, specializing in graph theory and advanced analytics. He has published over 100 scientific papers, authored 6 international patents, and contributed to more than 50 EU-funded research and development projects. Today, he'll introduce his presentation titled Building an AI Framework for Employee Well-being. So, Professor Mršić, welcome, and I'll give the floor to you.
Thank you very much. So, in next few minutes, I will give you an introduction about AI and how frameworks, especially in the context of employee well-being, can be implemented in a different projects, not only this one, because we want to have, of course, the deliverable that are related to H.A.R.M.O.N.Y project, but also we want to create a framework or kind of guidelines or a guidebook that can be used for maybe some other initiatives, projects, or researches in the future. So please, can we go to the next slide? This is the short overview of the agenda, but we will focus on this first and the last slide, on the last 2 slides, so we can move on and say something about the fundamentals of AI. In the context of AI, we always think about the system, which is somehow fed by data. So you need data to create such systems. So identification of data, identification of ways how the data can be collected, what is the quality assurance of data, and how then the system, once when you have data stored, can learn from them, not only from the data that was collected in the past, but moreover to establish a system which can learn from some mistakes or some experiences that the system have over time of using it, in a way that the system itself is, let's say, responsible, and we have a deep understanding of how the system works. You know, or you heard about the term explainable AI, meaning that not only that the engineers need to know how they collected the data and how they trained the models, but also for the people who are the end users, it needs to be explained in a way that could be understood by someone who is just a user, not only an engineer who designs such systems. Can we go to the next slide? So artificial intelligence is a group of systems, or it could be explained in layers, and all layers are combined in the final solution, which is powered by data. Can we go to the next slide, please? And in such case, you have lots of examples of AI in daily life, or in this specific project, AI in medicine, meaning that you have some kind of sensors, and they produce very rich data logs, which at the end need to be somehow combined into final solution. Can we go into next slide? If we want to simplify building blocks, we could say that there is data, there are some mathematical algorithms, model which trains the algorithms into some kind of logic or some kind of knowledge, empowered with the computing power, of course, because you need the computers to run all the trainings. Depending on how much data you have, how much data we have, what is the quality of data, but in this particular case, when we are building a framework, in which data we will be using is important elements which helps people to understand how such systems could be built. There are many frameworks today that can be used as the examples. Can we go to the next slide? We will be building something similar to this. So from one side, you have patients, clinical protocols, meaning that we have a clinical perspective. Patients could be workers, could be whoever is the source of data. And on the other side, we have research outputs, final models, and some conclusions or solutions of how the data can be used. In between, we have data modeling techniques. So this is like a nice, brief way for people to understand what at the end, how at the end the solution will look like. Can we go to the next slide? Why are we using frameworks? Because we want to reduce development cost, to standardize workflows, because then they can be reused in some other projects. And using frameworks, meaning that the ease of use, understanding, integration, and everything else related to the data can be easily explained. In overall, can we go to the next slide? We have like multidimensional system. This is like visual interpretation of it with all the elements there, having a framework, meaning that if you slice this brick in any way, you at every moment know what you are doing and where is the intersection of data and the solutions, and how your data end up or being used in a model that end up with the solution. Can we go to the next slide? Implementing a framework, meaning that we are following the process of several steps. Some of the steps are already been done before we apply for the project or during the application phase. And now we are somewhere in the middle. At the end, we will be able to give recommendations on how the framework for this specific case, worker well-being, can be developed. Can we go to the next slide? Meaning that we need to find not only the data sources, but also the aspects, the groups of data that will be used to create a framework. meaning that if we are able to identify and to measure different data points, then we are able to combine them into models. We can use different aspects, but at the end, you can go to the next slide. But at the end, it looks like this. So trying to figure out what are the connection points within the, let's say, average working day of an individual, to try to figure out how can we collect the data without any harm and use them in a final model. Meaning that, can we go to the next slide? Meaning that at the end, we have different aspects of AI that can be implemented during the different phases of the day with the different data, which at the end can be combined with the clinical perspective and provide insights both for the understanding that some state is in place, or that we need to measure or monitor, maintain the connection within longer period of time to understand that there is some change in the behavior of a person. Can we go to the next slide? And from the perspective of originality of the H.A.R.M.O.N.Y perspective, we decided to take a look at the current landscape of the different solutions, because these implementation of AI solutions in lots of industries is changing rapidly. So we want to be up to date with it. Then using those information, we will try to derive out all the data points that are used. So for example, you will be surprised how many decisions or how many end results we can create based only on the, for example, human temperature, heartbeat, and the number of hours someone is spending to sleep. So with only 2 or 3 data points, you can create lots of interesting insights, not because something is happening with us in the specific moment in time, but if you measure those elements over the time, you will see some differences in the behavior, which end up with the increase of stress level, anxiety, etc. Meaning that in this task 3.3, we will develop a framework and provide the guidelines for the architecture of, how the best practices and the knowledge of the consortia can be used to create a system which then will be tested and validated in the form of the H.A.R.M.O.N.Y project. As the final result, we will develop guidelines and recommendations how AI technologies can be used, both from a technical, clinical, and at the end, I say patient, but worker perspective, meaning that not only that the professionals need to know how to create such systems, but also the communication with the end users need to be very, very open, because there is a big gap in willingness of the final users to use such solutions, because this is very sensitive. The monitoring process and everything that we can derive as a result can be very, very sensitive. And our last slide is a wrap up. So we know that, but it's always good to repeat it again and again. So AI is a transformative force, can be very, very efficiently used in healthcare, but this integration must balance technology and the human aspect. So the human need to be in the middle, and this is very, very sensitive area that our project is tackling. So the carefulness need to be on a much higher level than maybe in some other projects. And having said that, we need to address all the complexities, because it's not just any AI system. It's like a tool which can be very powerful. If it's used in the proper way. Our last slide is just the contacts. So if you have any questions about the project, you can refer to me or my colleagues. And I'm looking forward to present new deliverables in the next period in time. So thank you very much for your patience, and I'm giving it back to the moderator. Thank you.
Thank you, Leo, for that overview of the role of the Algebra University in the H.A.R.M.O.N.Y project, as well as for showing how AI framework work. And thank you also for raising the ethical topics of usage of digital technologies in mental health care, which definitely needs to be taken into account. I would like to just add that we are now collecting the data on factors and measurable indicators which can be used within the framework. So you mentioned some of these, like blood pressure or heart rate variability or sleep patterns. So these are definitely things we are going to take into account while working on the final output of the project. So thank you for your presentation. And now if we have any questions, not so far. So please feel free to add your questions in the chat or comments anytime during the session. You're very much welcome to share your thoughts with us, and you can contact us via the chat function. Okay, so if Lucie is here, we can get back to the findings from the survey and from the interviews which were conducted in the project earlier this year. So, Lucie, can we?
Yes, thank you. I would like to, given that we are talking about AI and digital technologies, I would like to apologize for my technical difficulties, and I will remain without camera just to make sure my Zoom doesn't crash again. And speaking of digital technologies, if we could go on to the next slide. Talking about digital technologies. So when we look at the use of digital tools among SMEs, collaboration platforms like Teams and Slack are pretty widespread for education and upskilling. About a quarter of our sample also use internal e-learning systems, but perhaps surprisingly, roughly a third of the SMEs reported using no digital tools at all. Despite this, there is a lot of openness to digital or AI-assisted tools. The main concern, however, remains data privacy. And when it comes to learning approaches, SMEs clearly prefer blended learning, combining online resources with face-to-face interaction. Now, moving on to the qualitative side of our research, which focused on higher educational institutions and vocational educational schools. We can see that many higher education institutions have direct access to mental health experts, either through research or partnerships, which means students get high quality and up-to-date information and support. In several countries, strong support structures are already in place, for example, counseling centers in Finland, Czechia, and Norway. We also saw initiatives like mental health days in Germany and Czechia, along with workshops that are a part of everyday student life. Moving on to vet schools, innovative teaching methods such as storytelling and role play are being used oftentimes to engage the students in a more interactive and meaningful way. And vet schools focused on health and social care, for example, in Latvia and Czechia, psychology and well-being are very often already integrated into the training curriculum. Let's, however, talk about the gaps in mental health education, which are very informative for our project. The biggest gaps are in vocational schools, where mental health education is often missing, unless the field is directly related. Even in higher educational institutions, coverage is uneven. For example, STEM and technical programs often don't have structured mental health support. And outside major cities, the topic tends to get less attention in a number of countries. Large class sizes, especially in vet, make it hard to create safe spaces for students to talk openly about sensitive issues, which is connected to stigma, another barrier, where we found that vocational students sometimes see well-being topics as irrelevant. We also learned that where universities are addressing mental health, counseling services are very often overloaded or understaffed. And this is particularly noticeable in countries like Finland and Czechia, where demand far outpaces the available resources. And we had two overarching themes that emerged from our research. First, teachers are very often expected to support students in crisis, even without formal training. This happens either because students trust them or because urgent situations, like a student facing a panic attack, require immediate attention. And second, educators frequently lack resources. They often rely on personal experience, knowledge, or informal networks to provide support. So in short, while progress is being made, there's still a lot of work to do to ensure all students across all disciplines have access to meaningful mental health support. Across countries, there's a growing emphasis on holistic well-being, including stress management, resilience, and self-care. Some universities, particularly in Finland and Czechia, are even connecting mental health to broader themes like building sustainable careers and managing uncertainty. And as you can see, digital tools are widely used. Higher educational institutions rely on structured platforms such as Teams, Mentimeter, and Moodle, while vocational schools often use gamified tools like Canva and Kahoot to engage their students. AI is, perhaps not surprisingly, increasingly part of student life. Students use it for writing tasks, while teachers tend to use it for saving time. And though teachers are more hesitant, especially amongst older generations, many of them recognize its potential usefulness. Very interestingly, teachers report digital fatigue in both themselves, but especially in their students, and note a loss of a sort of face-to-face skills amongst their students, highlighting the ongoing need for real human connection. This slide shows where our two worlds, education and the workplace, really come together. They align on 3 key points. Both educators and SMEs see a training gap as the biggest shared challenge. And across both sectors, stress, burnout, and general well-being remain central concerns. Everyone agrees that digital tools can support well-being learning, but they cannot completely replace human connection. Where they differ is in focus. Educators are working on curriculum and systemic change, while SMEs need practical, day-to-day solutions for supporting staff. And together, this creates a shared opportunity to build a lifelong learning pathway for well-being, where awareness starts in education and continues into the workplace. The message is simple. Mental health is a shared responsibility between educators and employers, and collaboration between these sectors is where real impact happens. These takeaways are closely linked to what H.A.R.M.O.N.Y is actually building. First, to integrate mental health education across learning and work, we're developing 8 training modules for SME employers and educators, focusing on work-related stress, anxiety, and depression. They're practical tools to help leaders prevent and manage the most common mental health issues in the workplace. And this way, we're also strengthening the capacity of educators so they can embed mental health topics directly into teaching and curriculum design. To ensure consistency, we're promoting an exchange of good practices amongst researchers, safety experts, labor market actors, laying the foundation for centralized universal guidelines. And finally, our work on AI technology supports the blended learning, where we're combining digital and personalized approaches. With all of this coming together on an interactive digital platform, making H.A.R.M.O.N.Y not just a research project, but a set of real, usable solutions for mental health in both education and the workplace. So as we've seen, mental health isn't just nice to have, it's essential. Mental health education is the foundation for sustainable learning, empathetic leadership, and thriving workplaces. So let's take what we've learned and make it a reality for every student, employee, and leader. Thank you.
Thank you, Lucie. Thank you for sharing these data and insights coming from these data in relation to the expected outputs of the H.A.R.M.O.N.Y project. It'll be interesting to see how these findings are going to shape the project's next steps, definitely. Unfortunately, we do not have any question in the chat, but I believe that it's time to move into our panel discussion and Q&A. So, dear participants, this is your opportunity to engage with our speakers directly. So please raise your hand using the reactions panel if you'd like to comment or ask a question live, or you can still use the chat function and we can read some of them out during the discussion. So let's begin with a short exchange among our panelists. Maybe we could probably can stop sharing the screen so we can see each other. Thank you. So perhaps I could start with a question, maybe to Linda, probably. So Linda, so based on your experience, so what do you see as the biggest opportunity and also the biggest challenge for improving mental well-being in workplaces today in relation to usage of digital technologies?
According to my experience, I see two main challenges. The first thing is reaching SMEs, really reaching SMEs, because usually when we look at the ways how you reach companies, it's usually through networks like employers, organizations, sectorial organizations. However, the really small and tiny micro companies, they are not members either of employers' confederations, sectorial associations, geographical organizations. So that would be one of the challenges. And the other challenge is a very diverse digital skills of employees. From one perspective, it's age problem, because also when reading the interview transcripts from Latvia, from the vocational teachers providing vocational education, it was clear that young generation don't have any problems with digital tools, with artificial intelligence. However, that's a real challenge for the teachers who are sometimes afraid. They don't have sufficient skills. They are not creative enough to create or start using AI for training. So it might be changing, but we need to overcome this stigma or fear maybe from that side. So these, from my perspective, these are the two main challenges. However, most probably there are many more.
Thank you very much. Yeah, I believe that the age related thing is definitely a thing. Do any of you, the panelists or the participants, want to add any other? Do you want to comment on that? All right. If not, my next question goes to Lucie, because you mentioned that only a few companies covered by your research have company level policy addressing mental health at work. And my question is if this factor is going to be is it going to be covered within the project? Like if the project will provide any specific recommendations or guidelines in this area, or if there are any which can be shared within the project among the participating stakeholders?
Yes, we are currently in the process of utilizing what we found to design the education modules, but we are hoping that the project will provide practical, actionable guidance for companies. So many of the education modules we hope will include specific guidelines for managers on how to cope with stress, depression, and anxiety in themselves, as well as how to recognize early warning signs in their colleagues and employees. And they will also cover how to initiate a supportive dialogue and refer to appropriate services and sort of implement company-level action plans and policies. So the focus really is on providing managers with concrete tools to build a supportive and proactive mental health culture in the workplace.
Thank you. And the project itself aims at like providing a platform to share experience and share good practices among different stakeholders, different institutions and companies. So I believe there will be also like a time for sharing in between the participating companies. Thank you very much. Okay, so let me just quickly remind that there's still space for you to raise your hand to ask a question or comment on anything what has been said so far, or you can put your comment or thoughts in the chat. My next question goes to Leo, because so you've touched on the role of digital tools and AI in supporting well-being, but how do you see technology challenging like these mostly spread human-driven approaches to mental health at work in the near future? Like what is the possible challenge of integrating AI-based tools in the mental health at work?
Yeah, thank you. We often been approached to people who from one side they feel pressure, fear of missing out, fear of efficiency and everything that's related to modern way how they work, and at the same time pressure of understanding the technology and how technology can help them in their work, in their life. And we often say to them that technology brings us to this position where we feel so much of a pressure, but technology can also help us to move on from there in the same manner. So we just need to know how to use it. I'm very affirmative towards technology. You can decide about your own view. Does the technology bring something good or bad? But in general, technology became the regular aspect of our daily lives, and we probably cannot move it out because if we move it out, then there are many positive things that we are using at the moment will then be absent, and then we will feel that the thing is not the same, that our life is not the same. Now, work-life balance was a challenge even before technology. So this is like a common topic, but how we can use technologies to try to measure some of the things that we do during the day, because sometimes we go through our lives, waking up in the morning and go to work, and then family, and then sleep, and then again work, etc., etc. And with this increase of pace of technology, so many emails, so many discussions, so many interactions with people, because global technology and this webinar is putting us in perspective, even though we are now at the moment on different geographical points. Meaning that you can have your whole life in your phone or in your computer, meaning that you need some other techniques and work on yourself about how to deal with all of that, because there's so many things going on for many of us during the day. And sometimes you can take and accept that it's normal, something that maybe don't have to be normal, because we are not paying attention to understand how really these things change us as humans, because you're constantly running into something and constantly feeling pressure that you missed something, etc., etc. And I think that within technology, with the proper angle of applying the technology with lots of communication, of course, as I said before, with a human in the loop, people who will be interpreting the results, who will be aligning and changing, adopting the solutions to be more human aware, to be more appropriate for our daily lives. I think there is a great opportunity there, because without that, we are on a road that don't look so good. So we need to use technology. I think this it's not a promise. It's something that we need to do. And the more projects like this, the more discussion about this, the more information that we can share. Even sometimes we cannot offer the final solution, but we can offer a small concept or a fragment of technology, or put some food of thought, and then the people will think about it and move on from there. So the level of I wouldn't say protection maybe, but the level of resilience will increase because we know that two most important skills for the future are to be resilient and to be able to adapt to a new situation, which is maybe two the complex ones. It's not easy, to adapt to anything that happened to you. Yeah, in theory, we should do it, but in practice, it's not so easy. And being resilient, meaning that whatever comes your way, you need to try to face it. I don't think we can face it alone. So we need a kind of groups. We need all the aspects that are already present in clinical from clinical angle. So professionals know what needs to be done. With technology, we can offer that service to many or much more people, which is, I think, a promise of H.A.R.M.O.N.Y as well.
Absolutely. Thank you very much for your answer. I would also suppose that one of the challenges could be also like setting a balance between these human-driven approaches and technologies themselves, because as was shown also in the research, and Lucie was talking about it in the previous presentation, that some voices also call for these like human-driven approaches in terms of the trainings and these like educational activities. So I believe that it's going to be about finding a balance between using the technologies, which we cannot get rid of, and we are definitely need to exploit them for their best, but taking this into account as well. Thank you very much. We have two more questions which came through the registration forms. So let me please read them out loud. The first one is from AIS. I'm not sure if anyone from AIS is present, but I can read the question and you feel free to comment on that. Unfortunately, I don't know the name of the participant. We are working in Italy to develop a guideline about suicide prevention in the work environment. Do you think that it presents a connection between mental health and suicide risk in the work environment? I believe that Lucie could be a good person to answer this question.
Yes, definitely. Yes, suicide prevention guidelines are very valuable and definitely do connect mental health and suicide risk in the workplace. However, I would like to point out and highlight that it's equally important to focus on broader mental health education and prevention. Suicide is typically the most severe outcome of if we put it on a continuum where stress or chronic stress can lead to anxiety, which can develop into depression, or the two are very often comorbid. And then in extreme cases, this can lead to suicide. So addressing mental health early through awareness, support, and preventative measures reduces the risk of reaching that severe end. So the guidelines should ideally connect suicide prevention with a proactive mental health support and not just crisis response.
Thank you very much. Thank you very much. Do any of our speakers want to add something to that question? All right. Then there's one more from Dr. Anthony Umuna from Nigeria, from Nigerian Maritime Administration and Safety Agency. And it says, how can telemedicine applications aid mental health assistance for seafarers? I'm not sure who would love to answer this question. But it was partly answered by Leo. But if you want to,
yeah, maybe I can try. So
build on that.
Yeah, so we are paying attention a lot about the development of telemedicine. Us as a research group, as a university. So we see, for example, a rising trend of people asking for a second opinion using the telemedicine, because some of the most prominent doctors, especially if you are dealing with some rare states, with some rare situations, are not available in every country, but you can easily reach them via using digital technology. You just need to send the documentation that you already have, and they give you a kind of second opinion. So there is a big increase in having something like that available, meaning that, you know, from the perspective of providing a service and from mental state of the person who needs the service, being able to access or to have access to high-level professionals in such easy way, because you can do it from your home, really increase your resilience, because you know that you will be treated in the most, I would say, is the best possible way, which is for sure good. One other thing is that using telemedicine, you can also, using different kind of sensoring equipment, you can be connected to a system if you want that, for sure. But you can be connected to a system which is important in, for example, in cardiology or in some other aspects, which can also include a kind of stress resilience as well, meaning that probably you can have in the future your own tool accessed only by you on your mobile phone, which can help you personally without interfering with the external expert if you don't want to do it, to know more about your current state. In the past, we had different things, like you had a special kind of tape, which you can put your finger on, and the tape will tell you if it turns red that you are under stress. But those kind of solutions in the past were not very precise. Today, with very sophisticated sensory equipment, we can be more precise, but still such solutions need to be used and developed in very careful way. So I think there is a big promise, and I think there's a responsibility from all of us not to make it an overpromise, but, you know, to find a really decent human way how to deal with it. And yeah, I think, you know, the future is bright in terms of that, but we still have lots of work to do.
Absolutely. I believe that it was a great closing remark, because the time's up. So I would like to thank to all our speakers for excellent contributions, and to everyone in the audience for your attention. I'm sorry we haven't managed to engage you more in the discussion, but I believe that we will manage to do that in one of our next sessions, because today's session was the first in a series of the H.A.R.M.O.N.Y events, where we'll continue to explore how collaboration and digital innovation can be improved in terms of well-being and mental health at work in Europe. So we invite you to stay in touch with us, and you can follow our updates via Facebook, LinkedIn, YouTube, or our webpage. So feel free to check these sites. And on behalf of the H.A.R.M.O.N.Y Consortium, thank you once again for joining us today, and we look forward to seeing you at our next session, which should take place in April. So have a lovely day.